There are several people that come into the office that have concerns about anesthesia, and their concerns are resided around the fear and ramifications and the like of what could or might occur. Usually what I do is to kind of allay those fears, kind of discuss the fact that I have performed over 15,800 moderate IV sedations. We have every bit of equipment times 2 that you would require to be able to do this, and that my assistant is actually a registered nurse, and we are both advanced cardiac life support trained. So it brings that kind of peace of mind again, because some people come from the anesthesia fear side and some people come from the surgical fear side. And from the surgical fear side, we just kind of distill it down into, the mechanics of it, kind of making it seem a little bit more straightforward so it isn't a mystery. But from the anesthesia side, it's very difficult to distill it down into a mechanical reference point. And so it's really talking about the sheer experience that I have. And I think that brings kind of peace of mind, particularly for the parents of the first young child, that bringing in the teenager or the really pretty much everyone from every walk of life.